Okay, so we've downloaded a patient, and now all the records are going to show for this patient. We're going to look at the chart window. So now the chart window, we're going to click on chart here, and the information for the patient comes up here where we have all our diagnostic notes and what we've done. They have some charting here in a digital diagram. That's all coming down here. This window, you can type anything you want, and that will always stay. You won't have to look down the progress notes to find some piece of information. So let's say the patient is scared of needles. So we would write scared of needles. Now when anybody brings up this page, everybody will always see this note. So it's a quick and fast way that you can actually see notes just in this little window. Now, the progress notes, we'll get to that later, but this window is very important because this is where we have existing treatment and treatment that's already been rendered and treatment that's going to be rendered. And this is where we're going to talk more about, you have to learn that teeth are named, and each tooth has a number associated and 5 sides associated with it. So quickly, I'll just break this down. We think also in quadrants. So 1 through 8 is the upper right quadrant. The upper left is number 9 through 16. Lower left is 17 through 24. And 25 through 32 would be the lower right quadrant. Now, these quadrants are important to think about that way. If you go to dental school, that is clearly going to have to be kind of delineated. It helps you think about the numbers, the numbering system, and how we put together treatment plans and all of these things. So the other way we think about it is simply upper arch or lower arch. So you have a maxilla or you have a mandible. Now, the other section that you would look at teeth is you would look at front teeth or back teeth. So we describe the organization of your teeth in different ways: quadrants, front or back teeth, or we call them anterior or posterior teeth, or we look at them as just simply numbers. That would be the other way. Or we look at them per arch. So there's different ways to describe where the teeth are at and where the treatment's going to be carried for. So.